Ladies and gentlemen, Minister of Health of Indonesia, Budi Gunadi Sadikin, is entering the room. Also, welcome to Ms. Christopher Murray, Director of Institute for Health Metrics and Evaluation. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, may peace be upon you. Excellency, distinguished participants, colleagues, welcome to this momentous occasion where we gather here to witness a significant milestone in our collaborative effort to improve public health, especially in Indonesia. My name is Daniar Akhri, and I'm so honored to be part of this special event. Before we go further, I would like to extend a warm welcome to our esteemed guests, Excellency Budi Gunadi Sadikin, Minister of Health of Indonesia, Ibu Syarifah Liza Munira, Deputy Minister of Health Policy Agency, and Dr. Chris Murray, Director of Institute for Health Metrics and Evaluation. We are truly honored for your presence here today. Ladies and gentlemen, as we already know, currently the Indonesia of Ministry of Health and the Institute for Health Metrics and Evaluation, or IHME, are collaborating to carry out a joint venture or joint project office to increase Indonesia's ability to estimate disease burdens and burden projection until 2050. And there are four main components of work will drive our goal. Together, MoH and IHME will first assess existing data system to understand what analysis can be supported and what gaps we might yet fill. Second, produce district-level burden estimates. Third, forecast burden against health system capacity, including human resources of health by profession and specialty, to identify areas of emergence needs and inform health resource planning. And the last, build capacity within Indonesia to directly contribute to such analysis with a dedicated cadre of fellows. Ladies and gentlemen, without further ado, we would like to continue and invite Ibu Syarifah Liza Munira, Deputy Minister for Health Policy Agency, to deliver her remarks. Ibu Liza, please have the floor.
His Excellency Bapak Budi Gunadi Sadikin, Minister of Health of the Republic of Indonesia, Professor Christopher Murray, Director of the Institute of Health Metrics and Evaluation, IHME, Dr. Diane Gu, Chief of Philanthropy at IHME, Head of Provincial Health Offices across Indonesia, distinguished guests and colleagues, ladies and gentlemen. Indonesia's healthcare and transformation agenda, as we all know, is determined to produce evidence-based policies that are at par with best practices globally, in collaboration with local and international partners. Today, we gather to mark an important milestone in this effort as we launch the joint operation between the Ministry of Health and the Institute for Health Metrics and Evaluation, IHME, and the formal signing of the governance agreement as a follow-up to the MOU signing in Seattle in November 2023. This governance agreement will serve as a framework for running the joint operation to ensure clear governance, transparency, and accountability in our joint efforts. Within this agreement, we have laid out specific activities of the partnership for the next 5 years, which include data systems and disease burden estimates up to the district level, forecasting healthcare burdens and system capacity, accelerate disease registry systems, and capacity building, which includes fellowships. Your Excellency, ladies and gentlemen, we've already kicked off on these activities with a workshop and data sharing session this morning to exchange knowledge between local and global experts with the aim to have IHME methodologies to be tailored to Indonesia's specific healthcare needs. The morning sessions were attended by provincial health offices from across Indonesia, both in person and virtually, key units from the Ministry of Health, as well as academic experts from universities such as Universitas Indonesia and Universitas Airlangga, who are also present as speakers and moderators. Pak Menteri dan Bapak Ibu, I'd also like to report that we've set up an IHME office at BKPK, Ministry of Health, to underscore our commitment to this partnership. This office will serve as a hub for health data collection, analyses, and decision-making to really strengthen Indonesia's capacity in planning and responding to healthcare challenges in real time. Your Excellency, distinguished guests and colleagues, so this partnership is not just about data crunching and data analysis, but it's about building a healthier, more resilient Indonesia, not only addressing current healthcare challenges, but also shaping the future of healthcare in Indonesia for generations to come. As I end my report, I kindly request His Excellency, Minister Budi, and the Director of IHME, Professor Murray, to share your remarks to mark the formal signing of the governance agreement and officially launch the significant joint operation between the Ministry of Health in Indonesia and IHME. Thank you.
Thank you, Ibu Liza. Next, distinguished guest, His Excellency, to set the stage for our discussion, we are honored to have Bapak Christopher Murray as a director of IHME to deliver the report for this event. So please join me in giving a warm welcome to Dr. Murray.
Good afternoon, Minister Budi. Great to have you here and be able to participate in this launching of our joint work together and taking the next step. It's very important from my perspective, this effort. The global burden of disease has been running now for 33 years, started by the World Bank. I was fortunate to be asked 33 years ago by the World Bank to start this work and have kept at it. And now with the Institute for Health Metrics and Evaluation, we've expanded the set of global public goods or analytics that we think can help evidence-based policies. So there's what are people's health problems through the burden of disease? What are the resources being devoted to address disease country by country by donors, which we call financing global health. And then the third leg of these analytics has been the more recent expansion of work on forecasting. We actually started forecasting in 1998, but the methods and the sophistication of forecasting has really become much more useful for policy making. And over that journey, we've gone from analysis in Geneva, in Washington, at Harvard, or wherever the institutional base was, to progressively expanding the participation so that we have a collaboration of 12,000 people in 163 countries. But the next step, represented here, is actually trying to bring the analysis and have it occur in countries, extend the skill set capacity to do these advanced analytics, and to directly serve leaders in ministries of health and in the health system. So I'm very excited to be able to participate in this effort here in Indonesia under a visionary minister, and I have high hopes that this can be a model for other countries as well, as we see this sort of approach to joint analysis and being directly embedded with the health policy formulation in the Ministry of Health. So congratulations to everybody in this effort, and we're very excited to be part of this journey. Thank you very much.
So please remain on the stage, Dr. Murray. After this, we will have a signing agreement. So we now have come to the signing of the governance between the Ministry of Health and the Institute for Health Metric and Evaluation. The signees will be Ibu Sharifah Liza Munira and also Dr. Christopher Murray, and it will be witnessed by Bapak Budi Gunadi Sadikin as the Indonesia Minister of Health. Please, Ibu Liza and also Dr. Murray. Yeah, let's signing off the agreement between the Ministry of Health and IHME. So let's switch and exchange document. The signing of agreement also witnessed by Bapak Budi Gunadi Sadikin and also of us here. And we will have a photo session, but please, with the document. So, sir, madam, we will capture a moment of these momentous occasions. This is the beginning of our collaborative journey toward a better health, especially in Indonesia. Thank you, Ibu Liza, and also Dr. Murray. You may return to your seats, and please remain on the stage for Bapak Budi Gunadi Sadikin. Ladies and gentlemen, it's my great pleasure to introduce and invite you to hear the Honorable Bapak Budi Gunadi Sadikin, Minister of Health of Indonesia, remarks.
Chris and Diane, welcome to Jakarta. Ladies and gentlemen, good afternoon. Almost a year ago, I met Chris for the first time. Chris is a very quiet person, very knowledgeable, and he showed to me how the global burden of diseases of data and how it can be used to forecast and to do planning by simulating what will happen in the next 10 to 15 years. And I also knew from Chris that many countries already adopted this model to help planning the right infrastructure to support the health of the people. I remember if you are a general and you have a good planning, it is already a half of the war won. So that's why I strongly believe we need to have a very good planning. And at that time, Indonesia had a very poor planning. I remember we would like to deploy our cath labs, but we don't have enough specialists. So I talked to Chris, can we start with burden of disease and then extrapolate for the next 10 years? Because to produce a specialist, it needs 4 years to 6 years. So we cannot plan now and then get the product 6 years later, because then the condition will be different. So then we decided, let's have a long-term planning and use epidemiological data to anticipate what are the type and the size of the burden of diseases that will happen, learning from other country history. And we stick with this model, because after we stick to this model, then we can design our healthcare facilities. The primary healthcare clinics, now we have 10,000 at 10,000 districts. The number of hospitals that we are spread, 3,200 that we spread over 514 cities. So we can design our national healthcare facilities. Which one is run by private sector? Which one is run by government sector? And which one are focused on elderly like me? Or which one are focused on young people because the epidemiological status? which one have the competencies more on cardiovascular, which one has competencies more on infectious diseases, because depends on the locations and the environmental situation at a particular cities. So first, I would like to use CRIS data, epidemiological data, burden of diseases data, with a certain forecasting based on the pattern from other countries to design our healthcare facilities. And number two, we would like to use this also to deploy our medical devices. We get already a very large amount of loan from the World Bank. We would like to deploy the medical instrument. But we want to deploy the medical instrument according to the burden of disease. If we want to deploy medical equipment about malaria, not all cities have malaria. Or we want to deploy a certain dengue or rabies, or high burden of cardiovascular or mental health issues. And we would like to distribute the medical devices based on this model. And number three, we would like also to deploy the people, the number of people, the specialists, the doctors, the nurses, which are very specific skills into a particular locations. And we can define the location, I asked Ibu Lisa, down at a district level. Indonesia have 38 provinces, 514 cities, 10,000 districts, and 85,000 villages. My target is not that tough because I didn't ask for 85,000 villages. I asked for 10,000 districts. We can get the data down to the 10,000 districts, both epidemiological data and financial data, and then we can calculate the productivity of our healthcare programs or intervention at the district level. And we can see which one are efficient, which one are not efficient. And we can improve the not efficient one. And the last one, so after the healthcare facilities, the medical equipment, the design or planning for human resources, also about the financing. Because I want to know, based on, I asked Chris, do every country follow the same pattern or not? Budi, he said, very, very clear. If you become richer, then the pattern is very clear. So if the country become richer, malaria will not increase. Cardiovascular will increase because you eat so much, you have access, you have become lazy to run. But when you get even richer and better educated, then they realize you can eat everything, but you can die sooner. So they start exercising like crazy, the size of the body is become slimmer. Then a different diseases come. Cancer disease will come. So of course then it will, the amount of money that we design should be, depends on the certain epidemiological conditions also at a certain population. If the population Jakarta are very rich, the population East Nusa Tenggara very poor, then that will be a different money deployment that we can design with our program because the type of diseases will be different. So that is our dream, and I said to Chris, we are lucky because we came late into this data space. So we can buy a cheaper hard disk, we can buy a cheaper storage, cheaper CPU, and cheaper internet access through Starlink with Elon Musk, compared with the previous country that we invest much more expensive because we are already at the end of the productivity curve of the price of the semiconductors and also the price of the bandwidth of the internet. So it's cheaper for us to enter that. But then we need those data that coming in to be analyzed. And that is where I thank Chris to extending his hand to helping the Indonesian to teach us how to analyze the data. And I give that responsibility to Pak Iwan, but during COVID, Pak Iwan is the one that can impress me. I'm a very demanding person. As a physicist, we are good in numbers, in financial modeling. Pak Iwan is the one that can impress me. Oh, Pak Budi, this is the way you should see the analysis of the data. Because I don't want to see data. I always say that. I don't want to see data. I want to see information. You can give me a bunch of data, but you don't give me any information, then I don't need you. So Pak Iwan always give me the right information. he can simplify 1,000 pages of data into one-page summary of very good information on what causes stunting or what are the costs, for a certain intervention. So I said to Pak Iwan, let's work with Chris. And don't forget, Pak Iwan, your hair is already gray and white. Bring the young guy with black hair, to come with you and go to Chris Murray and then study. So we can have more young Indonesian, energetic, that can continue our work and do a much deeper analysis. And I can tell you, but white hair only grows on brain. So if you have black hair like this, actually my brain quality is less than yours. So again, thank you, everyone, and I wish all the data can be used to make a healthier Indonesian people and also good for the humanity. Thank you.
Bapak Budi, please stay on the stage for a launching ceremony. Bapak Budi, there are 2 light balls as a symbol gesture. You may pass the light balls to the performer. Bapak Budi, you may return to your seat. Please give big a round of applause, ladies and gentlemen. Ladies and gentlemen, to welcome a performance as a symbolic gesture launching joint operation, Ministry of Health of Indonesia and Institute for Health Metrics and Evaluation.
Today marks a historic milestone in Indonesia's healthcare journey as the Ministry of Health and the Institute for Health Metrics and Evaluation join forces to transform healthcare data and planning in the country. The bustling heart of Indonesia, Jakarta, is now home to the IHME office, a center for innovation and collaboration. This office will serve as the foundation for our 5-year joint operation, aiming to enhance data-driven health policies. With a dedicated team of experts, this collaboration brings together the brightest minds to tackle Indonesia's healthcare challenges. Together, we will produce forecasts and estimates essential for healthcare planning and workforce allocation. Using insights from the Global Burden of Disease study, we will estimate the national demand for specialists, such as cardiologists and oncologists, ensuring that healthcare services are equitably distributed across the country. The IHME Fellowship Program will train Indonesia's future health leaders, providing them with cutting-edge skills in data analytics, forecasting, and policymaking. This 3-year program spans Jakarta and Seattle, empowering fellows to implement their learnings in real-world health settings. Workshops and data sharing sessions are critical components of this joint operation, fostering knowledge exchange between local and global experts, and ensuring that our methodologies are aligned with Indonesia's unique healthcare needs. By 2050, we aim to have a comprehensive forecast for healthcare demand and workforce productivity across Indonesia. This data will guide our policies and ensure that we are prepared to meet the future health needs of every province. The newly renovated IHME office at BKPK, Ministry of Health, stands as a symbol of commitment to this joint operation. This office will be the epicenter for health data collection, analysis, and decision-making. This partnership between the Ministry of Health and IHME is not just about data, but about building a healthier, more resilient Indonesia. Together, we are shaping the future of healthcare for generations to come.
Once again, let's give big a round of applause, ladies and gentlemen. So today is very historical, like Bapak Budi Gunadi Sadikin said before. Ladies and gentlemen, we now have come to the end of this event. I would like to express my gratitude to every one of you to have contributed the success of this event. Thank you very much to our distinguished guests and also the representative of MoH and IHME and everyone who has joined us today until the end of today's event. Excellency, distinguished guests, ladies and gentlemen, to capture this momentous occasion, we would like to have a photo session. So please, teman-teman untuk membantu. To capture our memorable event, let's have a photo group. For VIPs, please, you may stand up in front of the stage. And I also invite Direktur Utama PT Bio Farma, GE Healthcare, Direktur Utama PT Bank Sentral Asia Tbk, Direktur Utama PT Pertamina Persero, Direktur Utama PT Riau Andalan Pulp and Paper, Direktur Utama PT Bank Mandiri Tbk, Direktur Utama PT Bank Negara Indonesia Tbk. Dan saya juga memanggil dan juga mengundang kepada seluruh kepala dinas kesehatan atau yang mewakili dan Bapak Ibu pejabat di lingkungan Kementerian Kesehatan Republik Indonesia. Mohon teman-teman untuk dapat mengatur posisi. So, untuk semua kepala dinas dipersilakan untuk dapat naik ke atas panggung. Once again, I would like to invite seluruh kepala dinas kesehatan atau yang mewakili Bapak Ibu pejabat di lingkungan Kementerian Kesehatan Republik Indonesia. Please come on the stage to have a photo session. Let's be prepared. 3, 2, 1. Once again, 3, 2, 1. I would like to ask Bapak Budi Gunadi Sadikin, is there any pose, special pose for this event? Salam sehat bersama Bapak Budi. Baik semuanya, 3, 2, 1. Is it enough? Thank you very much, sir and madam. Let's once again give big a round of applause for for this event from morning until this afternoon. Strategic collaboration workshop of utilization of global burden of disease 2021 and launching joint operation the Indonesia Ministry of Health and the Institute for Health Metrics and Evaluation. Ladies and gentlemen, this is the end of our afternoon event. I am Daniar Akhri is signing off. Enjoy the rest of your afternoon. Wassalamualaikum warahmatullahi wabarakatuh. Thank you. Terima kasih banyak Pak. Sampai